So, good morning, everybody. The topic for today's class is Amphibian Cardiac Experiments, Part 2. And in the previous class, we had discussed about the how the dissection of the frog is done, and then the procedure of how to record a normal cardiogram, and also the properties of the heart muscle was demonstrated. So for today's class, the objectives are the effect of stimulation of vagosympathetic trunk on frog's heart, and perfusion of frog's heart, and effect of drugs, that is the nicotine and atropine drugs. Next objective is the effect of neurotransmitters, adrenaline and acetylcholine on the frog's heart, and the effect of ions, that is the sodium, potassium and calcium on the frog's heart. So these are the objectives for today's class. Now coming to the apparatus, the apparatus required will be chymograph, Sherrington Starling's drum, frog board, Starling's heart liver, frog ringer's solution, pins, one hook pin and thread. This is like for the previous normal cardiogram recording only. And this Starling's heart liver is different from the muzzle liver, that it is very sensitive, and so can pick up the contractions, weaker contraction of the cardiac muscle when you compare it with the skeletal muscle. The frog's ringer's solution, the composition will be the sodium chloride, which helps in maintaining the isotonicity of the frog plasma, and potassium chloride maintains the membrane potential. Calcium chloride will help in maintaining the muscle excitability. Sodium sodium carbonate and sodium phosphate will also be present. These will help in maintaining the pH, and also dextrose will be there, which will help in providing the nutrition. So these are the composition of the frog's ringer solution. In the previous class also we have used frog's ringer solution. So this was the composition. And next is you'll be using the pins and thread. So coming to the procedure, so again we will be starting the procedure by dissecting the frog's heart. First we have to put the frog and then destroy the spinal cord, and then we will fix the frog on the frog board. You have to make a median incision of the skin over the sternum, and then enter the chest cavity of the frog and expose the heart, and then we will cut the pericardium up to the base of the heart. Now we pin the pericardium through the base to the board, that is we are fixing the base. When we fix the base, the apex is pulled downwards with each contraction. This ensures the force of contraction is directly transmitted to the liver, and this increases the amplitude of the recording. We have to next hook the bent pin through the apex of the heart, and you have to ensure that you are not rupturing the heart, and you tie the thread to the end of the pin, and tie the other end to the Starling's heart liver. The thread must be kept vertical and taut so that the contraction of the heart can be transmitted to the liver. The writing arm of the heart liver is now kept horizontal, and then the writing point should be just touching the drum of the chymograph, and then the drum is rotated at a slow speed, and the contractions of the heart will be recorded on the chymograph. And the normal recording, it is a repetition, the normal cardiogram. Again, you have to recollect that usually normal cardiogram in an ideal setup will show 3 waves, that is the sinus activity, S wave, or the A. Next is the atrial activity or the A wave, and the ventricular activity or the V wave. But in the routine laboratory setup, the sinus venosus contraction is not picked up by the liver, and so you will get only two waves, that is the A wave and ventricular V wave, so atrial activity and ventricular activity. So that is the B. You have to look at this. You can see the arrow. So this is the wave normally we will get. This is called as normal cardiogram. And the downstroke of the wave will represent systole. The downstroke will represent the systole, and the upstroke will represent the diastole or relaxation of the heart. And knowing this, now we will move on to the first experiment. That is the first experiment for today. That is the effect of stimulation of vagosympathetic trunk on frog's heart. For this, you should first understand what is vagosympathetic trunk. So before understanding what is vagosympathetic trunk in frog's heart, you have to recollect what is the nerve supplied to the human heart. The human heart is again supplied by the sympathetic and parasympathetic nerves. So this sympathetic nerve, the green color one, the they arise from the preganglionic, these preganglionic sympathetic fibers will arise from the lateral horn cells of upper 5 thoracic segments of the spinal cord, and they emerge via the ventral root. They emerge via the ventral root and enters the paravertebral sympathetic chain via the white rami communicantis. And these fibers will relay, these fibers will relay in the superior, middle and inferior cervical ganglion, and the post-ganglionic sympathetic fibers will start running in the superior, middle and inferior cardiac nerves, which will form the cardiac plexus, and then finally they will go and innervate your cardiac tissue. Because of the embryological origin, the sympathetic fibers in the right side will innervate mainly the SA node, and the sympathetic fibers in the left side will innervate mainly the AV node. The postganglionic sympathetic fibers form the subepicardial plexus, and their action is mediated via noradrenergic or noradrenaline, which will mainly bind to the beta-1 adrenergic receptors. So the main neurotransmitter that will be released here by the sympathetic nerve is the noradrenaline. And these sympathetic fibers have a stimulatory effect, overall stimulatory effect on the heart. So that is, it is having a positive chronotropic effect, which that is increase in the heart rate, positive inotropic effect, that is increase in the force of contraction, positive dromotropic effect, that is increase in the conductivity, and positive bathmotropic effect, which is increase in the excitability of the cardiac cells. Next is the parasympathetic innervation. So you have to follow this pink fibers. The parasympathetic nerve is the vagus nerve, and this also has preganglionic and postganglionic nerve. In case of parasympathetic, you will have a longer preganglionic nerve, and this will be starting from the these fibers, the preganglionic parasympathetic fibers, arise exclusively from the nucleus ambiguous present in the medulla oblongata. These fibers run in the vagi, and because of the embryological origin, again the right vagus will innervate the SA node, and the left vagus will innervate the AV node. These preganglionic fibers relay in parasympathetic ganglion present near the node, near the heart. Generally, it is near the viscera, and then The SA node, AV node, and the atrial musculature will be innervated by the postganglionic nerve. But the ventricular musculature is not innervated by the parasympathetic nerves. Note this, that the ventricular musculature is not innervated by the parasympathetic nerves. And that's why, so stimulation of the vagus will cause inhibition of the SA node, AV node, and atrial musculature. And the ventricles will also stop beating after its stimulation because of vagal inhibition, but it can resume the beat after some time, and that is called as ventricular rhythm or idioventricular rhythm. Next, these vagus or parasympathetic nerve usually have the inhibitory effect on the heart. It decreases the activity of the heart by decreasing the, that is, it will have a negative chronotropic effect, that is decreased heart rate, negative inotropic effect, that is decrease in the force of contraction, negative dromotropic effect, that is decrease in the conductivity of the heart in the conducting tissue, decrease in the, or the negative bathmotropic effect, which is decrease in the excitability of the cardiac cells. These effects are mediated due to the release of the acetylcholine via the muscarinic receptors. The activity of the nucleus ambiguous in turn in the medulla will be regulated by the impulses which are coming from the cerebral cortex. One more concept that you have to know is the vagal tone. So vagal tone is defined as the degree of inhibition exerted by vagal impulses on the heart during rest. Vagal tone is the degree of inhibition exerted by vagal impulses on the heart during rest. So these inhibitory impulses from vagi will arise from the cardiac inhibitory center in the medulla oblongata, and these activity again is regulated by the afferent impulses from the baroreceptors, which will be present in the wall of the carotid sinus and aortic sinus, which will be carried by the sino-aortic nerve, and these impulses in the vagi will exert a restraining effect. The feedback from the sinoatic nerve will cause decreasing restraining effect. As a result, the resting heart rate is maintained in between 68 to 75 beats per minute. When the resting heart rate is less, it will mean that the vagal tone is more, and vice versa. So whenever there is increase in the vagal tone, decrease in the heart rate will happen. That you will usually see in athletes who will have an increased vagal tone, and their resting heart rate will be around 40 to 60 beats per minute when compared to the normal 60 to 70 beats per minute. And in children, the vagal tone is low, and so that they have higher heart rate in children. So this vagal tone can be demonstrated by uh, counting the heart rate before and after the vagotomy. But in experimental animals, this will be done. That is surgically, you will cut the vagus. That the procedure is vagotomy. Or you can also do this by cooling the vagi. The impulses from vagi is stopped, and you can see the effect. In human beings, it can be studied by the chemical vagotomy, that is by using parasympatholytic agents like atropine, and that will block the muscarinic action of the acetylcholine at the parasympathetic and cardiac muscle junction, and you can see the effect. So with this knowledge, we will move on to understand what will happen in the frog's heart during the experiment. That is, this picture shows the course and relation of the vagosympathetic trunk in frog. What is the difference between the human vagus and sympathetic nerve to that of frog is that here The vagal and sympathetic fibers to the heart cannot be stimulated separately as these fibers are mixed to form a single nerve, the vagosympathetic trunk. You can see here the carotid artery and vagus and the parasympathetic nerve, all three together will form vagosympathetic trunk. And stimulation of the vagosympathetic trunk will result in the cardiac inhibition as the vagal effect predominates over the sympathetic effect. But if the vagosympathetic trunk is stimulated for a long period, the facilitatory effect of the sympathetic may overcome the inhibitory effect of parasympathetic nerve. And also you should know that the white crescentic line in the previous class where we applied the first ligature, this white crescentic line which will be present between the sinus venosus and atria is the parasympathetic ganglion in the frog's heart, and stimulation of this white crescentic line causes cardiac inhibition. That part also you should know. So knowing these, the conclusion is that the vagus and sympathetic trunk, sympathetic nerve are present together in frog's heart. That's all. Next, coming to the principle of the first experiment, that is the stimulation of the vagosympathetic trunk will result in cardiac inhibition. However, if the stimulation continues, the heart recovers from the inhibitory effect of the vagus. This is demonstrated by recording the effect of vagosympathetic stimulation of the heart on a moving drum. So the requirements for this experiment is same as that for recording of the normal cardiogram. Along with that, you should have an electrical circuit for stimulating the heart. The procedure is that for normal cardiogram, how you do the dissection, you have to fix the heart, then you have to first fix the base to the board and then hook the apex and connect it to a thread, a vertical taut thread, which in turn will be connected to the liver, and that liver with the writing pin will be approximated close to the moving drum. And during the dissection, extra what you have to do is that you have to isolate the vagosympathetic trunk. The vagosympathetic trunk should be confirmed from the other structures. So what will be done is by observing the cardiac inhibition, by stimulating the nerve, you will be able to tell it is vagosympathetic trunk. You have to stimulate the trunk and then see for the decrease in the heart rate, and so that will confirm that it is vagosympathetic trunk. Then you will proceed with the experiment. So first you will be recording the normal cardiogram, and then you will stimulate the vagosympathetic trunk with a strong with a lower strength initially, and then record the activity. Then again you will allow the normal cardiogram to be recorded. Then the strength of the stimulation will be increased, and you will record the readings. Then after the heart completely stops after stronger stimulation, which we call it as vagal inhibition, the recording again continues and you will see the waves. This effect will be called as vagal escape. So what is happening here is, first we recorded a normal cardiogram, then we stimulated the vagus nerve, and when the vagus nerve was stimulated with the lower strength and there was more impulses from the vagus nerve, there is inhibition. The parasympathetic nerve will decrease the activity of the heart. So the heart rate has decreased and even the force of contraction has decreased. But if the strength of stimulus is increased more and more, the heart stops beating, and this we call it as vagal inhibition. Because of the vagal stimulation, the vagus will cause cardiac inhibition, that we call it as vagal inhibition. So you can see in this graph here that there are no contractions of the heart recorded. After some time, when this you should continue giving the stimulus. After some time, what happens is that the contractions will start appearing at more slower rate and with a lesser force, and this is called as vagal escape. This is because you have to recollect that the ventricles are not innervated by the parasympathetic nerves, and the ventricle will start producing its own activity, or it will start producing its own rhythm, and this is called as vagal escape, and the contractions are recorded. So next, so how this happens is, if the stimulus is strong, the heart stops and the cardiac inhibition occurs due to the release of acetylcholine at the nerve endings. This increases the potassium conductance in the nodal tissue. This is the mechanism. At the node, the potassium conductance will be increased, and so there is increased leaking. The opening of these potassium channels will cause increase in leaking of the potassium, and the node gets hyperpolarized, and so the acetylcholine and will cause decrease in the heart rate. Also, the acetylcholine causes decrease in the concentration of the cyclic AMP by inhibiting adenylate cyclase enzyme in the cells, and so this will also cause decrease in the opening of the calcium channels, and that in turn decreases the calcium entry into the myocardial cells, and force of contraction will decrease. What you have to remember is the potassium will cause the hyperpolarization and decrease the heart rate. The calcium is the one which will cause decreasing the force of contraction in the myocardial cells. What you have to note here is the heart rate mainly is controlled by the nodes, the SA node specifically here, and the atrial muscles, they will have these are also innervated by the parasympathetic cells. There, the calcium conductance is reduced. So the muscle contraction will be inhibited or decreased. So two sites you have to remember, that is the at the node and at the cardiac muscle, two different. The heart rate, potassium, and the force of contraction is the calcium. Next, the vagal escape, and the causes for this vagal escape in case of frog, that is what is vagal escape we discussed already, that is a strong vagal stimulation may abolish the spontaneous discharge of the heart for some time, and the heart stops temporarily. So it is a temporary phenomenon. Then the heart recovers, and automatically, even after the continuous vagal stimulation, this is called as vagal escape. The causes for this is, in frogs, it is the idioventricular rhythm, that is when the heart stops due to the vagal stimulation. The ventricle starts generating the impulses, which is known as idioventricular rhythm. It is called idioventricular because the cardiac rhythm is due to the pacemaker activity of the ventricular muscle. The exact cause for this was not known when the naming was done, so it is called as idiopathic. And as the discharge rate of the ventricle is much less, the idioventricular rhythm will be significantly having a lower heart rate compared to the normal. It can also be because of the depletion of the acetylcholine. So even if you're stimulating, then there is no acetylcholine, so no action of the vagus. So what happens is, when the vagus nerve is stimulated continuously, the acetylcholine released at the nerve endings is depleted after some time. So the acetylcholine also is degraded rapidly by the enzymes choline esterase, and the effect of the vagal stimulation on the heart is heart becomes temporary, and the vagal escape can happen. Sympathetic stimulation, it is just believed that when the vagosympathetic trunk is continuously stimulated, the sympathetic fibers are also activated, and it will start stimulating the heart. And in humans, the sympathetic and vagal fibers are present separately, uh, and continuous stimulation of the vagus nerve results in vagal escape. But the predominant cause in humans is the idioventricular rhythm, not the depletion of acetylcholine or sympathetic stimulation, but it is only the idioventricular rhythm. And you should also know what is vasovagal attack. Stimulation of the vagus nerve causes sudden and transient loss of consciousness. This is known as vasovagal syncope or vasovagal attack. It is also called as vasovagal syncope. And it occurs due to the inadequate cerebral blood flow that results from the abrupt vasodilation and decrease in the cardiac output. So also, when a person sees blood, sometimes you might have observed that they will faint, and that will be because of the vasovagal attack or vasovagal syncope, because the emotional state, increased emotional state in them will depress the vagal activity, and so there is decrease in the force of contraction, decreased heart rate, so decreased cardiac output and decreased cerebral circulation to the, and that is blood supply to the brain, and so there is syncope. This is the vagal syncope or vagal attack. And next, the a few words about vagal tone. That is, in the normal heart in humans, the normal heart rate is about 70 beats per minute, which is significantly very less than the intrinsic heart rate of the heart, that is about 100 to 120 beats per minute. So what do you mean by intrinsic heart rate of the heart is when it is denervated, when both human heart, when both sympathetic and parasympathetic nerves are cut, the heart can beat by itself at a rate of about 100 to 120 beats per minute, and only when sympathetic nerve is allowed to send its impulses, it will beat at a rate of 40 beats per minute. And when only sympathetic is allowed, then the rate will be 140 beats per minute. But in a resting heart, what happens is when both sympathetic and parasympathetic is allowed, the vagus will predominate, and the heart rate is around 70 beats per minute. So this is the vagal tone. And then this vagal the tone has inhibitory influence, and these also sometimes you should also know something called a sympathetic tone is also present, and this will normally increase the heart rate, but normal vagal tone predominates over the sympathetic tone, and this is the reason why the heart rate is normally less than its intrinsic heart rate. That is, the intrinsic heart rate is 100 to 120 beats per minute. You know, so this is about how the vagosympathetic nerve, when trunk, when it is stimulated, how the recording is got, and these are the few applied aspects. That is the vasovagal attack and the vasovagal syncope. Now we'll move on to the next experiment. That is the effect of nicotine and the atropine on the frog's heart. The principle is atropine is a muscarinic receptor blocker and nicotine is a ganglion blocker. The vagus nerve and the white crescentic lines are stimulated before and after the application of atropine and nicotine to determine the site of action of these drugs. So atropine is a parasympatholytic, and nicotine also. So we will see how and where it will act. So the requirements for this experiment is same as that for recording of the normal cardiogram. And along with that, you should have a nicotine solution of 7%, and atropine solution of 0.5% will be taken. And then for understanding the perfusion of the frog and the effect with these drugs and the effect of it on it, you should know that the parasympathetic nerve fibers, which is the vagus nerve, has pre and post ganglionic fibers, which you are already aware. But you have to recollect that it has, this is the parasympathetic nerve, it has a pre-ganglionic fiber and a post-ganglionic fiber. The preganglionic fiber releases acetylcholine, which acts on the nicotinic receptors, the dark blue color nicotinic receptors, and the postganglionic fibers also release acetylcholine, and they will act on this green color muscarinic receptors and open the acetylcholine channels that you all know, gated potassium channel, and also it will cause inhibition of the calcium entry. So that is the action. What you should know is the ganglion will have nicotinic receptor, and the viscera, that is the heart here, as muscarinic receptor. Here, the sympathetic nerve also has ganglion, and this ganglion will have nicotinic receptors. Again, acetylcholine is released, whereas the postganglionic fibers will be releasing the noradrenaline, which will have alpha and beta fibers, beta receptors. The beta receptors, beta 1 mainly is present in the heart cardiac muscle, beta 2 in the nodes. So these are the receptors. Here we are bothered about nicotinic receptors, which are present in the ganglion, and the muscarinic receptors, which will be present on the cardiac muscle. But in the frog, this is in the humans, in the frog, you should know that the preganglionic nerve, to stimulate it, we will actually stimulate the vagosympathetic trunk. The preganglionic nerve fiber will become the vagosympathetic trunk, and the white crescentic line. The white crescentic line at the junction of the venous sinuses and the sinus venosus and the atria is the ganglion. That is the parasympathetic ganglion. So when you stimulate that, you will be stimulating the postganglionic fibers. So for preganglionic fibers, we will stimulate the vagosympathetic trunk in the experiment, and the white crescentic line for postganglionic fiber we will be stimulating. So knowing this, we will move on to the procedure. So the procedure is that for recording, first you have to record a normal cardiogram on a slow moving drum, and then stimulate the right vagosympathetic trunk. Right vagosympathetic trunk, because that is the one which will supply the SA node. The AV node will be supplied by the left. So you will stimulate the right vagosympathetic trunk by a strong Faraday stimulus to record the vagal inhibition. Next, you will apply electrodes on the white crescentic line and stimulate this white crescentic line with Faraday stimuli till the heart stops. Next, you will apply the nicotine solution on the heart and record the effect. Directly, the nicotine will have no effect, so there will be no change. And then you will stimulate the vagosympathetic trunk, that is for preganglionic nerve, and then the white crescentic line for the postganglionic nerve, and you will record the findings. Next, after recording the findings, you will wash the heart with the Frog's Ringer's solution, and then you will record the normal cardiogram. After the normal cardiogram resumes, then you will apply the atropine to the heart and record the effect. And again, atropine directly when you put, there is no effect seen. Then you have to stimulate the vagosympathetic trunk, record the finding, and then stimulate the white crescentic line. Again, record the finding, and then you will label the graph that will be obtained. So here, this is the graph that will be obtained. What is your observation here is that you are having the normal cardiogram initially. Then what you do, you will stimulate the vagosympathetic trunk, which is the preganglionic nerve, preganglionic nerve of the parasympathetic nerve. And so there is increase in the acetylcholine, and so there is increased activation or release of acetylcholine from the postganglionic nerve also, and finally the heart will be inhibited. Parasympathetic has inhibitory effect, and so this is vagal inhibition or cardiac inhibition has occurred. Then when you stop the stimulus, so these are the waves which show the stimulus, and then when you stop the stimulus, you see that the normal cardiogram has resumed, there is no inhibition. Then you will stimulate the Y crescentic line, that is your post-ganglionic nerve. And again, there is increase in acetylcholine, which will act on muscarinic receptor and inhibit the heart. So vagal inhibition, cardiac inhibition. And then there is again the normal recording of the cardiogram. Next, what you are doing is you put nicotine. After adding nicotine, you record the cardiogram. There is normal cardiogram. Now you stimulate the you stimulate your vagosympathetic trunk. When you stimulate this vagosympathetic trunk, because this nicotine goes and blocks the nicotine receptors present in the synapse here, that is in the ganglion, uh, you the acetylcholine will not be able to act, that is released from the preganglionic nerve, and so there is no inhibition of the heart, and normal cardiogram is recorded. After some time you stop, and then again, then now you stimulate the white crescentic line, that is the postganglionic nerve. Here this will cause inhibition because it is not under the influence of the nicotine, and then you record the normal cardiogram. So the site of action is at the ganglion, which is the site where the nicotine will be present, nicotinic receptors will be present. Next, the effect of atropine. So you add atropine. Atropine will go and block the muscarinic receptors, which is present on the heart. So now, whatever you do to the preganglionic nerve, that is your uh, vagosympathetic trunk, there is no effect. Postganglionic nerve you stimulate, whatever you stimulate, still whatever acetylcholine gets released from these nerves cannot act on the heart because the receptors are blocked and it is out of the vagal influence, and so it will continue beating in this normal pace. So this is the effect. So how exactly at the molecular level this will happen is that at the nicotinic receptors, which will be present on the post ganglionic nerve, this nicotinic acetylcholine receptors, when the agonist, that is the nicotine, comes and attaches to this, it will the agonist will be the acetylcholine. So whenever this acetylcholine comes and attaches to the receptor, it will open and cause increased sodium entry. Increase in the sodium entry will cause the excitation of the cell, and there is impulse generation in the postganglionic nerve. That is how the impulses are conducted. You know about this very well, how the conduction of impulses happen in the synapse. And next, at the postganglionic nerve on the heart, when it relays, it will act on the muscarinic receptor. So the neurotransmitter is the same. Acetylcholine again will be released here, and this will act on the muscarinic receptors. Here, this will is a G protein coupled receptor, and this G protein coupled receptor, because of the GDP getting converted into GTP, again this the active G alpha will go, and there is opening of the potassium channels, and there is leaking of the potassium to the exterior, and hyperpolarization will happen. Because of that, there is decrease in the heart rate. Also, this acetylcholine, again, this G alpha will be inhibiting the adenylyl cyclase enzymes in the cardiac cells, where this cyclic AMP, decreased cyclic AMP, will cause decrease in the calcium channel opening and prevents the entry of calcium into the cell. So there is decreased force of contraction. This is at the molecular level. So finally, what we understood by this experiment is that you know that the nicotine is the ganglion blocker and the atropine is the muscarinic receptor blocker. So we came to know the site where it blocks. Next experiment is perfusion of the frog's heart and the effects of the drugs. Here we'll be using the drugs adrenaline and acetylcholine and the ions, that is the sodium, potassium and calcium ions, and seeing for the effects of these on the heart. So the principle is the effect of drugs adrenaline and acetylcholine and the ions and how they change the rate and force of contraction of the heart. That is the principle. The requirements for this is the different chemicals that you want to use will be 1% calcium chloride, 1% potassium chloride, 1% sodium chloride, 0.5 ml of 1 in 1 lakh solution of adrenaline hydrochloride, and then 1 in 10 lakh solution of the acetylcholine. Sims cannula and Marriott's bottle is the extra instruments that you'll be using in this procedure for adding all these chemicals. So coming to the procedure, first you will again pick the frog, expose the thorax of the frog and remove the precardium, pass a fine thread around the sinus venosus. Then with a pair of sharp scissors, you will make a small slit in the sinus venosus and introduce Sims cannula. So extra thing that you'll be doing here is you are introducing the Sims cannula into the sinus venosus and then tie the thread around the neck of the cannula and cut the heart out of the frog. That also you will be doing. And then you will connect the cannula with the, you'll be connecting it to the marionette perfusion bottle. And this perfusion bottle will contain the frog's ringer solution. I have told you the composition of ringer solution: sodium chloride, potassium chloride, sodium chloride for isotonicity, potassium chloride to maintain the membrane excitability, and then the sodium carbonate and sodium bicarbonate and sodium hypophosphate will help in maintaining the pH, and dextrose for nutrition. So that will be the composition. And then this frog's ringer solution. Then you will perfuse the heart with the ringer solution and you will record the heartbeat on a slow moving drum. First you have to, instead of the blood, it is the ringer solution that you will be perfusing with, and you will record the heart rate. Next, you have to record the effect of the drugs and the ions by applying each chemical separately with the help of a separate dropper. Directly on the heart, you will be applying the chemicals and the drugs and you will record the findings on the moving drum. So how you will do that is first 1 ml of 1% calcium chloride you have to add, a record, and then you have to perfuse it with ringer solution from the Marriott's bottle. The ringer solution will come, clear of the calcium, and then you have to record the normal cardiogram. Then add 1%, 1 ml of 1% KCl, then record, and then perfuse the frog's heart again. Repeat it with the sodium chloride. Then the same procedure will be repeated again with 0.5 ml of 1 in 1 lakh solution of your adrenaline, and then with 0.5 ml of 1 in 1 lakh solution, 10 lakh solution of acetylcholine. So normal cardiogram should be taken before and after recording the effect of each chemical. Next is we will see what happens to the recordings after application of each chemical. So first, we will see the effect of adrenaline on the frog's heart. Adrenaline is a neurotransmitter and which will be released from the from the sympathetic nerve, and it is also released from the adrenal medulla. And this adrenaline will actually cause increase in the heart rate as well as increase in the force of contraction. The heart rate you can count here, amplitude will show the force of contraction, we'll say. So obviously it can easily be made out that the force of contraction has increased and the rate also is increased. The increase in the heart rate is due to the molecular basis. You should understand that is due to the action on the nodal cells via B2 receptors, and there is increase in the cyclic. It will cause stimulation of the adenylyl cyclase enzyme, which will cause increase in cyclic AMP production. This cyclic AMP will cause opening. It will facilitate the opening of the long-standing calcium channels, and that will increase the depolarization phase of the impulse, thereby increase in the heart rate. Acting directly on the cardiac muscles via beta 1 receptors, it increases the calcium influx and to some extent sodium influx also, and so there is increase in the force of contraction. Please always note that on the node it is beta 2 receptors, and then there it is the pacemaker activity that will be altered, and there only the heart rate will be altered. These adrenaline, sympathetic nerves will innervate the atrial and ventricular musculature also. On the cardiac muscles, it will act directly and it will cause increase in the force of contraction by increasing the calcium and sodium influx. So after understanding that the molecular level, how the adrenaline acts, we will move to the effect of acetylcholine on the frog's heart. So extensively you have understood about how parasympathetic nerve causes inhibition. So there again it is on the same acetylcholine that will be released, but here we are adding it, the synthetic acetylcholine will be added and you will be seeing the effect on the heart. So what happens is you are already aware and well understood that it will decrease the heart rate and the force of contraction. So acetylcholine is also a neurotransmitter. Neurotransmitter chapter is already over for you. So adrenaline, acetylcholine, you know the receptors, you know how it is synthesized, how it is degraded, how it will act, and in these are the major neurotransmitters: adrenaline, acetylcholine, and then the GABA, etc. So acetylcholine is a neurotransmitter and it is released in many sites in the nervous system. And this acetylcholine acting directly on the pacemaker cells via the muscarinic receptors, it will increase their permeability to the potassium. So there is increased leaking of these ions to the out, that is from inside the cell, it will go outside because the concentration gradient, along the concentration gradient. And so it will result in hyperpolarization, that is more negative inside the cell, and this decreases the slope of the phase 4 of your action potential, cardiac action potential, and then which increases the time interval between the action potential. So there is decrease in the heart rate. This will come as a 3-marker question in your exam. The mechanism of action of acetylcholine at the node or at the molecular level. You should be able to explain this, that how exactly the acetylcholine decreases the heart rate. And then acting directly on the working cardiac muscles, your working cardiac muscles is your atrial and ventricular cells. The acetylcholine will increase their permeability to the potassium and decreases the cyclic AMP by inhibiting the adenylyl cyclase enzyme. And so there is decrease in the entry of the calcium and there is decrease in the force of contraction. It is very, very important from the exam point. You repeatedly get it as a 3-marker question. And then now, after understanding how acetylcholine acts, we will move on to the effect of the sodium chloride on the frog's heart, the next chemical. So what happens is where after perfusing the heart with Ringer's lactate and then you Ringer's solution, and frog Ringer's solution, and then you add the sodium chloride. High concentration of sodium alone causes weakening and finally failure of the contraction of the heart. You can see the way there will be weakening of the heart contraction, and then finally there will be finally there will be failure of the contraction of the heart. That is, there will be stopping of the heart, and usually it happens at the diastole. And increased extracellular fluid of sodium will interfere with the action of the calcium, which is the link between the excitation and contraction. That is the reason why there is decrease in the force of contraction. That is about the sodium, high concentration of the sodium. The normal extracellular fluid concentration of sodium in humans, you should know that it is 135 to 145 milli equivalent per liter. So whenever there is hyperkalemia for natremia, that is increase in sodium contraction for any reason, it will directly affect the heart by decreasing the force of contraction, and in severe cases it can actually affect the heart, compromise the functioning of the heart. So coming to the effect of potassium chloride on the frog's heart. So here after potassium chloride, after washing the frog heart with the Ringer solution, you put potassium chloride, 1 ml of potassium chloride is added, and then of 1% potassium chloride. Excess potassium will decrease the rate and force of contraction. The heart finally stopping in the diastole, and the high ECF potassium decreases the resting membrane potential of the muscle cells, and because of this reduction in the concentration gradient across the cell membrane, there is decrease in the resting membrane potential, and also there will be decrease in the intensity of the action potential that is produced. So as a result, the force of contraction is also decreased. So potassium also, repeatedly I kept telling that the concentration of the potassium in the extracellular fluid is very narrow, which is 3.5 to 5.5 milli equivalent per liter in your body, in human body, and hypokalemia or hyperkalemia both can affect the functioning of the heart. Here we are seeing the hyperkalemia. When increased potassium is there, it will cause decrease in the excitability of the cell by decreasing the resting membrane potential, and the intensity of the heart is decreased. Finally, when the concentration is too high, there is stopping of the heart. So it can actually lead to death in case of humans. So next is the effect of calcium chloride on frog's heart, the last chemical. That is about again 1% of 1 ml calcium chloride will be taken, and then it will be added to the heart, frog's heart, and after recording the normal cardiogram, you will record the effect of the calcium. So you can see here what is the effect of the calcium. Excess of calcium will increase the force of contraction, and the heart ultimately stops in systole. In potassium and sodium, the heart will stop in diastole. In case of calcium, the heart will stop in systole. And here you can see the very, very high concentration of calcium continuous contraction of the cardiac muscle will lead to increased availability of this calcium, will lead to something called as calcium rigor. The part of this excess calcium ions in the ECF of the T tubules are added to the calcium that will be released from the terminal cisterns, and as a result of this, more and more calcium is made available to the contractile machinery, and the force of contraction increases. So the heart stops in systole because the diastole does not occur at all, because contraction, the heart stops in contraction. And this is the calcium rigor. And when there is increase in the calcium, this is the cardiogram that will be recorded. So in this graph, you can also see the action of potassium and also the action of the sodium, weakening of the heart, and here it is the again decrease in the force and the rate of contraction. So this is about all the chemicals that are acting on the heart and its effects. So we saw adrenaline, which increased the heart rate and the force of contraction. The acetylcholine, which decreased. The calcium, the sodium and the potassium decrease the heart rate and force of contraction. Calcium will increase, and then it ultimately stops in the systole. That is called as calcium rigor. So that is about the different experiments that are conducted on the cardiac uh, tissue of the frog, and we saw the effect of it. So thank you. So all of you can wait. I'll just take attendance.